Hello again, I'm Natalia Vasquez, your pelvic health physiotherapist. So now you are 4 weeks into your self-management plan of pelvic floor exercises. And I really hope that now you are feeling the benefit and your symptoms are much better. Now, to allow this to continue, it's really important that you understand how breathing plays such an important role in your pelvic health symptoms. Okay, so to make this simple, I brought your pelvis again. Remember, it looks just like your pelvis. And this balloon right here at the top represents your diaphragm, and that is your main breathing muscle, which sits right here under your ribs. And at the bottom, the balloon represents your pelvic floor. Remember, it goes all the way from here to here and from the front all the way to the back. When we take a deep breath, this should happen. And I want you to sort of pay attention to what goes on your pelvic floor. So when you take a deep breath, your pelvic floor goes down a little. And then when you breathe out, it goes back up again. So it springs and it moves along with your diaphragm. For the next couple of weeks, what I'm going to ask you is to take lots of deep breaths. 10 times in the morning and 10 times in the evening when you're in bed. I would like you to put a hand on your chest and a hand on your stomach. And when you take a deep breath, the only hand that should really be moving is the one in your stomach. So let's just try that. Let's take a deep breath in through your nose. This hand should stay as still as possible, and this hand should come out a little. And then I'm going to ask you to hold that breath for 6 or 8 seconds and then breathe out. Let's do that together again. So let's take a deep breath in through your nose, all the way down into your stomach, and let's hold it there for 8, 7, 6, 5, 4, 3, 2, 1. And breathe out. Very good. What should be happening in your pelvic floor is when you breathe in, it should be going down, it should be opening the doors, and then when you breathe out, it should be going up and closing the doors again. But that happens without you knowing. So thinking about it makes it very, very useful. Okay, so your whole routine should now look like this. 5 times a day, you're doing your pelvic floor exercises, 5 of the long ones where you're holding for 5 or 7 seconds, 5 of the quick ones, and 2 where you cough. Then you're going to add the breathing 10 times in the morning and 10 times in the evening. And this is going to really help to keep your pelvic floor getting stronger, but also nice and flexible. And the idea is that your pelvic floor should be flexible, so then it really closes and goes up when it needs to. For example, when you need to cough, when you're coughing or when you're lifting something heavy, your pelvic floor should close the doors so you don't leak. Or when you need to go to the toilet but you can't, your pelvic floor closes and hold the doors closed, so then you can delay that trip to the toilet. But it allows the pelvic floor to also open up the doors and relax when it needs to. And that is, for example, when you need to open your bowels or when you need to empty your bladder. I hope that's clear. That is the next step, and I hope that you enjoy the breathing, which is going to benefit you in many other ways. I'll see you in 2 weeks' time. Best of luck and bye for now.